everybody, my name is Dr. Tylee I am a chiropractor here at Venture Chiropractic, and today I just wanted to spend a few minutes talking to you about a very common thing that we see in our office, and that is SI joint pain. So I'm going to go over kind of what is our SI joint, how does it get to be in pain, and then what are some treatment options that we typically would use with somebody coming in with this. Usually what happens is someone will come in with an injury of some sort. That can be from falling on the ice, maybe a sports or lifting injury, or even if they've just been sitting at their desk for too long, they will start to have pain in this area. So where is our SI? If we look at our model over here, right at the bottom of our spine, we have our sacrum. On either side of our sacrum, we have our ilium or our pelvis, and that is where our SI joints are located, where the sacrum meets the pelvis. So there's a few different reasons why this can cause pain for people. If we are looking at the SI joint itself, we can have a lack of motion in the area or too much motion that can cause pain. We can also have pain coming from the lumbar spine or even the hip joints themselves. So if you are having SI joint pain, it's very important you get it evaluated so that we can determine exactly the source of where the pain is coming from. So once we determine where that source is, we will have a few different options for treatment. Typically in our office, if we are finding any restrictions in the joints themselves, we'll use spinal manipulations, we'll use Graston for any soft tissue therapy. It's very important we pay close attention to the muscles and soft tissues around this area, as they are going to help stabilize our whole pelvis. And so once we have kind of treated the area, we are going to send our patients with exercises that they can do to help strengthen the area, which I'm going to show you in a second here. I am a chiropractor.
Hi everybody. As promised, I am going to be running you through some common exercises that I like to do with a patient who is having some SI joint pain. If you're trying these exercises at home and at any point you are feeling any discomfort or pain, please go in and get evaluated by your chiropractor. But the first exercise I'm going to do is a pelvic tilt. So this one is really good just to help getting that SI region moving. What you're going to think about is, as I'm lying on my back with my feet up, there should be a gap between your back and the floor, and what we're going to think about is flattening that lower back to the ground. Okay? Don't force it if you're having any pain or discomfort. We're just going to gradually move into that motion. Okay? This is a great one to start out with because it's really good for pelvic and rib positioning as well. Again, all of these exercises, we're really trying to focus on those muscles and joints around that SI region to help support the pelvis. So then this next exercise that I will like to do to help get a little bit more rotation into the pelvis is a hip hike. So if you have I love using the block, or if you have something similar size and height, that works great too. This one, I will typically start in a quadruped position, so on our hands and knees. One knee is going to be up on that pelvic block, or on that block, excuse me. And then from here, what you're going to think about is really loading that leg with the block. This leg and glute should be doing all the work. So from here, what we are going to do is try and lift that leg, opposite leg off the ground, lower back down, and lift and lower. You should be feeling more of a stretch through that glute muscle on the side that we have the block. Okay, and I'll show you kind of on the other side here, just how that other leg is not doing much of the work. Okay, we're going to be using that glute to lift and lower that leg. Okay, another great exercise, very good for getting some mobility back into the hips and pelvis. Now, this next exercise I really love using because there are so many different ways to use it. You can progress it or regress it as needed for somebody. So we're going to get back into that kind of pelvic tilt position. And this one is really great for getting that core engagement, glute engagement, and getting some more strength and stability back into the pelvis. So having our feet about hip width apart, we are going to get into that pelvic tilt, and then from there, you're simply going to lift your hips up and lower back down. And we're going to lift and lower. So really commonly, people will initially have pain with this one into the low back if they're coming in with the SI joint issues. So one thing that I see pretty commonly is people will start in that pelvic tilt, and then as they lift, they really start to overarch the low back, which is just going to be putting more pressure there, not where we necessarily want to be feeling it. So key thing is here, keeping that pelvic tilt the whole time. Lift to wherever you feel comfortable and lower back down. Okay? Another great way to help get the glutes involved in this a little bit more and getting a little bit more of a challenge is adding a band. So we're going to put that band just above the knees here, coming back into that starting position, pelvic tilt, lift, keeping tension on the band the whole time, and lower. Okay? Again, go through that one a few times. Now, sometimes people will still be having pain or not really feeling it as much. So another variation for this one, I really like to use this with pregnant women commonly. So we are going to take that pelvic block again, and what we are going to do is put that in between the thighs. This is going to get a little bit more of the adductors working. So adductors are very commonly forgotten about, and this will feel still in the glutes and adductors. So really great, again, for that pelvic stability. So from here, we're going to squeeze into that block, lift, lower back down. Okay? Again, trying to keep our ribs stacked over our hips the whole time. All right, and then last variation of that is one of my favorites, a single leg bridge. So this one is a bit of a progression, but sometimes when we lift, we're noticing one side wants to drop more than the other in that glute bridge. So what we want to focus on is just single leg variation. So from here, that one leg is going to be in that same starting position, lift the other, and from here, keeping the hips nice and level, again, don't forget the pelvic tilt, we're going to lift and lower. Okay, I'll show you on the other side here. Keeping that leg out, nice and relaxed, lift and lower. If you need a little bit more stability, you can also have your arms here just to help brace so that we're really isolating either side, okay? All right, so I really enjoy using those exercises. I see a lot of good results with them for myself and my patients. Again, I just want to remind anyone who is having some SI pain or knows anybody who is having some SI joint pain, it is really important to get evaluated. Here at Venture Chiropractic, our goal is always to help you move better, feel better, and be a better you. So please, if you have any questions or you would like to be seen by one of our chiropractors, please give us a call or schedule, and you can always like and subscribe for some more content.